The murmur of hypertrophic cardiomyopathy is a harsh, systolic murmur as shown in this phonocardiogram. Listen to a patient with hypertrophic cardiomyopathy. I will begin with 3 normal beats and then add the murmur. This murmur is often loudest at the 4th left intercostal space, but radiates widely across the precordium. Hypertrophic cardiomyopathy is a common genetic cardiac disease occurring in 1 in 500 adults in the United States. Hypertrophic cardiomyopathy is characterized by an abnormally thickened septum, although there can be hypertrophy in the mid-ventricle or even the apex. The obstruction to left ventricular outflow occurs between the thickened septum and the mitral valve, as shown here. The murmur of hypertrophic cardiomyopathy responds predictably to changes in afterload. With hand grip, there is a decrease in the murmur due to decreased obstruction across the left ventricular outflow tract. Listen to the change in the murmur of hypertrophic cardiomyopathy with a hand grip maneuver. I will begin with the patient in the resting position. Hand grip. The majority of patients with hypertrophic cardiomyopathy are asymptomatic, and population-based studies have shown a normal life expectancy for the group as a whole. Listen once again to the change in the murmur of hypertrophic cardiomyopathy with a hand grip maneuver. Hand grip. Despite the good prognosis for most patients with hypertrophic cardiomyopathy, there are subgroups at increased risk of sudden death. In young athletes, for instance, hypertrophic cardiomyopathy continues to be the most common cause of sudden death. When needed, there are a variety of treatments available for symptomatic patients, including pharmacologic therapy, dual-chamber pacing, alcohol ablation, and surgical myectomy of the ventricular septum, as shown here. In summary, hypertrophic cardiomyopathy is a common genetic cardiac disease, with most patients having a normal life expectancy. The murmur of hypertrophic cardiomyopathy decreases with a hand grip maneuver. Listen once again to a patient with hypertrophic cardiomyopathy. Mitral valve prolapse is the most common valvular disease in the United States, occurring in 2.4% of the population. Listen to a mid-systolic click and late systolic murmur of mitral valve prolapse. I will start with 3 normal beats, and then add the click, and finally the murmur. The click and the murmur are usually heard best at the cardiac apex, but the click may be heard throughout the precordium. Current echo criteria include 1 or 2 mitral leaflets displaced at least 2 millimeters beyond the mitral annulus. The click and murmur are affected by dynamic maneuvers such as squatting. Moving from the standing to the squatting position causes the click and murmur to move later in systole. Listen to the change in the click murmur with a squat maneuver. Standing. Squatting. In a classic study, researchers demonstrated that the click always occurs at the same ventricular diameter. Maneuvers like squatting that increase left ventricular size cause the click to move later in systole. Listen once again to the change in the click murmur with a squat maneuver. Standing. Squatting. The underlying pathology of mitral valve prolapse is myxomatous degeneration of the mitral valve. This leads to elongation of the valve structures and, on occasion, to chordal rupture. In some patients, there is only a mid-systolic click and no murmur. When the click is present, it responds to squat maneuver in the expected fashion. Listen to a patient with only a mid-systolic click. Most patients with mitral valve prolapse can have successful mitral valve repair when their regurgitation progresses to the point of heart failure. In summary, mitral valve prolapse is the most common valvular disease in the United States. The click-murmur complex moves later with a squat maneuver. Listen once again to a patient with mitral valve prolapse.